Further debate? The member for Sudbury.
Thank you, Speaker. It's always an honour and a privilege to stand and speak on behalf of the good people of Sudbury. And we're here today to talk about the budget and how it's going to impact people of Ontario, and in my riding especially. Going through the budget, Speaker, it appears to me that the government has different priorities than most people I talk to. During the election, and many of my colleagues on both sides of the House, we've all talked about this, the priorities we heard at the door while knocking on doors. So in Sudbury, the top three, hallway medicine, long-term care, those two are intertwined, and hydro. And I think they're similar for everybody. You might have a different order, but those most likely were your top three issues that came through. You know, hallway medicine, I remember I was nominated as a candidate a year before the election, and we had a press conference about hallway medicine. The number of days we were over capacity at Health Science North. A year later, during the election, we wanted to have a press conference because it was going on so long, and basically the press said it's not a news story anymore, it's become normal. That's an issue that has to get fixed, and people have been waiting since the election to be fixed. Long-term care, you know, the quote that stands with me, it was a Conservative. I knocked on his door. He was very clear. He wasn't voting. He's a card-carrying Conservative, but he said, we need to pay for the things that are important. That's right. I have parents in long-term care. When I'm not there, the people who work there are my family. And that stood with me. So we don't see ideology, we don't share the same political views, but we have the same core values about caring for our families. And hydro, as much as the government might break their arm patting themselves on the back one day, let's be honest, this election was about voting Liberals out more than voting somebody in. Now, I'm not saying there aren't good candidates, and I'm not saying everyone ran good campaigns, but people were motivated because they were really didn't like the Liberal Party. Really? They were voting people out.
We still don't.
Thank you. You know, and there was these promises. There were promises of a 12% reduction. You know, there was going to be lower rates for industry, and industry is suffering under these high rates of hydro. And I looked in the budget, and in the budget it says we're going to begin consultations and discussions with industry. I mean, this is a top three issue. You're going to begin now. It's been 9 months, Speaker. This is the time to begin was before the election, and to roll it out. And the priorities for the government, they don't seem to match what I heard at the door during the election. So this summer, as you recall, we were all called back for the election. Summer 2018, we rushed here. I found it weird being from Sudbury in Northern Ontario. We came to discuss the size of Toronto City Council. That was not a priority for anybody outside of 416. Honestly, I could care less if your city council is 4 people or 400 people. That's a municipal decision. You do what you want. What we do care about, though, hallway medicine, long-term care, and hydro. Now, you look at the government's priorities from reading the budget. We're back in Toronto. We're going to talk about the subway plan. We're going to redo a plan. Apparently, it's already in place. We're going to make a different plan. Again, great for if you're in the 416. Outside the 416, go north. And I know for some people, north sometimes is Barrie, but farther north even, we're looking for more priorities than what's going on with subways downtown Toronto. But you look at the budget also. You've got alcohol, you've got gambling, and you've got rebranding as the priorities. Yeah. These are the most important things. So I don't understand how we knocked on thousands and thousands of doors, as the Premier likes to say, to hear that hallway medicine, long-term care, and hydro are the priorities, and we decide alcohol, gambling, rebranding are the priorities. So under alcohol, and this is just my quick summary going through the budget, we talk about tailgating, and I've been to tailgates in the States, and they're fun. I have nothing against tailgating. You know, I don't know why it's a priority, though. We're going to designate some municipal parks able to sell alcohol, which I guess they could with beer tents. Now we're going to make it easier. We're going to start drinking earlier. You can sell at 9 a.m. I had a very interesting college career. I didn't know we couldn't drink at 9 a.m. I didn't know there was a problem that had to be fixed. Last calls, you may extend it past 2 a.m. I guess it's all right. I mean, there's going to be people with concerns. There's alcoholism. There's people worried about youth drinking. But at the end of the day, I don't think that anyone really thought these are the priorities, and we're asking the government to step forward on these. Now when you go to winery tours, you can have larger serving sizes. You get free alcohol at the casinos. The casinos can advertise they're getting free alcohol. And again, for the majority of people, I don't think any of this was a priority. You know, I read an article on Sudbury.com about more gambling options. It says, while you're sipping your 9 a.m. beer at the local pub, you'll also be able to bet on the Leafs game or buy a lottery ticket without leaving your bar stool.
Oh, great.
I don't see how that's a priority to people. At the end of the article, it says, to make a long story short, the 2019 provincial budget will give Ontarians more ways to gamble, easier access to booze that will help them forget about their losing bets. But the House always wins. And that's what we're seeing with the House always wins. I'm going to get into the branding. Now, I call it the vanity program. We're coming up with logos and slogans that, honestly, I didn't hear anyone really care before. If you ask the average person on the street what they think of the logo, I think many of them couldn't really describe it as the 3 men in the hot tub logo. They just, it's not a priority. They want to get end hallway medicine. They want better long-term care. They want better hydro. Instead, what we have are these cruel cuts. We expect cuts, but not cruel cuts. They're taking things away from children, from vulnerable people, from students, and especially the North. The cuts that are made in this budget are going to make life worse for people in Ontario. A couple of the stats. $700 million being cut from training colleges and universities. And then there's a threat to withhold as much as 60% based on targets in the future. There's going to be $1 billion in cuts to the Ministry of Children, Community and Social Services. Now, tomorrow I'm headed back to Sudbury to speak with families of children with autism. They feel like the government was reassessing and waiting for roundtables and more information and how to get the proper funding for the needs that their children have and their families need. They're at the end of their rope and they're very stressed out, Speaker. And in the budget, there's $1 billion of cuts. $566 million in cuts to Northern Development. The Ministry of Indigenous Affairs will see its budget cut in half to $74.4 million. This is not a government that has a good relationship with the Indigenous community. We had a throne speech that didn't do a land recognition.
Terrible.
We're seeing cuts here. We've merged the Indigenous ministry with Mines and Northern Development, which sends a message that the only time we want to have a conversation is if we can be profitable off of them. Healthcare and education spending squeezed to the point of wanting to be able to keep up with inflation. And these are services that families in Ontario really, really count on. And I can't help but believe that the message I get out of this is that this Conservative government doesn't think it's their job to help people. Exactly. I want to talk about hallway medicine. Number one issue, like I said several times already, I'm trying to drive that forward because it'd be nice if the government would go, we should do something about hallway medicine. Yeah. So people tell me stories about taking a loved one to the hospital, waiting for hours in the hallway. You have Facebook or any social media, you see it as a regular occurrence. Like I said, the year before the election, it was a story. Now it's a normal occurrence. Everyone has a story about it. And I'm not blaming this government. I know, and they'll say, we inherited a $15 billion debt. We get it. Because I remember for years and years watching the Liberal MPPs show up with a check announcing the underfunding of the hospital, and the hospital having to stand there sheepishly and pose for a photo with this check that wasn't even keeping up with inflation. And that left us hanging by a thread and desperate. And again, it goes back to the election. This was an election about getting rid of the old government and hoping for something better, But instead, hospitals received $272 million less than what was requested by Ontario Hospital Association. The OHA said that without this funding, staff reductions would be unavoidable. Again, I want to remind you, Speaker, the Premier said there will be no layoffs. Oh, yeah, I forgot about that. There will be no job losses. No one will lose their job. Suddenly, it's no involuntary layoffs.
What happened to that?
It's gone from no job losses. We have a 1% increase from last year's budget. So we're not even in the main status quo of the service provided. The status quo, I want to remind everybody, was horrible. Nobody was happy about it. Every single door they talked about hallway medicine. So status quo was not good enough. And we're not even keeping up with status quo, so we're not even doing as good as what was bad. Both the Health Quality Ontario and the Premier's Council on Improving Health Care and Ending Hallway Medicine have identified hospital capacity issues, wait times and system coordination as key issues facing the province's healthcare system. And I'm reading that, Speaker, just in case I think it's some weird lefty thing. The Premier's Council on Improving Health Care and Ending Hallway Medicine said we need to fix this. We need to tackle it. In my riding of Sudbury, cuts in the budget will severely impact our hospital, Health Sciences North. Health Sciences North is not just the Sudbury Hospital, it services the entire population of the Northeast. In 2018, there were only 18 days when the acute care site wasn't operating at more than 100% capacity. One record day, 539 patients were admitted to the hospital, which officially only has 446 conventional beds. And since Christmas, the hospital's been dealing with some of the highest occupancy rates it's ever seen. And this is a hospital that's been under pressure for a long time. For the last decade, there's been cuts and cuts and underfunding and cuts along the way. Last year, the hospital had an $11.1 million operating deficit. Imagine the stress of management in the hospital. Imagine the stress of the workers and the patients in the community with $11.1 million of funding underfunding. The hospital is forced to lay off 60 nurses. They don't call it layoffs, they call it attrition and balancing around, but still there's 60 fewer people working there. They had to cut services to try to balance the books. And the staff, which is breaking under the pressure, have to do more and more with less and less. And they've been calling on the government to step up since they were first elected, basically telling them what they need to do. And I'll tell you what they need to do. It's the same thing that a Conservative voter told me. We have to pay for the things that are important to us. Right. And health care is important to us. So this fall, CUPE 1623 President Dave Chelafondiak warned the staff they were stretched to the limit, and he called on the government to step up. So over the last year, morale among workers at the hospital has been low, and many were wondering when they were going to be the next to lose their jobs. And the cuts to the funding, even if you don't want to call it cuts to the funding, the underfunding of what's required for our hospitals is going to lead to layoffs. You can't do more with less. We've cut through the skin, through the fat, through the muscle, and we're into the bone, and we're digging into the marrow. There's nowhere else to cut. And these cuts are putting people's lives at risk. When you have too few beds to serve the region, and a rapidly aging demographic across Ontario and primarily in the Northeast, overcrowding has been an issue for more than a decade. This month, Health Science North announced they had balanced their budget after a difficult year. And I know they worked hard on this. We had consultations. The member from Nickel Belt was with me as well as a critic for health. And it was a struggle to get this done, and they had an announcement, and people were looking for relief. They were looking for better times ahead. And what they're looking forward to now is a lack of funding that won't even keep up with the cost of living. And that's the same stress we're going to have again. I was here recently last month, Speaker, talking about a friend of mine, Kimberly Kumarcharik. She's a leader in the community. She volunteers regularly at the soup kitchen. She's a steelworker. She's a secretary at the Steelworkers Local 6500. She was the one who got me involved with going in the coldest night of the year walk. She's all around a great person, a fantastic individual. And instead of doing a member statement about how great Kimberly is and how much she's contributed over the years to Sudbury, I have to talk to her. I had to talk about Kimberly here in the legislature, about her brother Danny and how Danny died in a hallway. He was 51 years old. He was dying from cancer. He spent 5 of his last 7 hours of his life in the emergency room being moved to an examination room where he died 2 hours later. I don't want to go into all the details because I know it's difficult when Kimberly hears the story, but whenever she talks about this, she has nothing but praise for the hospital staff. Imagine that. Your brother dies in the worst of conditions. You're watching your father grieve for him, saying this is not a way to die in dignity, and all you have to say for the staff in the area is praise. She says she could tell how urgently they were working to find Danny a bed, how much they cared, but there simply wasn't any room. And when he was placed in the examination room, the rest of the family was able to gather and be at Danny's side, but throughout the whole experience, their father kept saying, this is not dying with dignity, this is not dying with dignity. And this is a cautionary story to other people, an opportunity for the government to fix this. Kimberly doesn't want any other family to experience what her brother experienced, or family experience. She wants a public health care system that puts patients first, and not as a catchphrase, literally puts people first and funds properly. Also, in Sudbury, for years, we were fundraising and organizing for a PET scanner.
Years.
So my colleague from Nickel Belt probably spoke about it often here, spoke often in Sudbury about it, the funding for the PET scanner. It should be funded. It's a government source. But it wasn't. The Liberals set the bar very high. Sudbury, we're hardworking. There's a term underground called adapt and overcome. We reached the bar, we fundraised for it, and they're in construction of the PET scanner right now. But the government should fully support a project like this, and they're not. And we don't mind the challenge, we meet the challenge, but again, the lack of funding, we need a second MRI machine. The current one runs 24 hours a day, 365 days a year. It completes 13,000 scans a year. And we need a second one. But still, patients must wait an average of 52 days for a test that can be performed within a provincial target of 28 days. My colleague opposite was talking about the money tree, and I was looking actually at the gravy tree when my colleague from Hamilton West, Ancaster Dundas, was talking about the $1 million that was given to one of their colleagues, another salary of $354,000, $197,000 for another colleague, the money we're going to spend on vanity products like license plates, logos, and slogans, the $308 million that they gave away to their wealthiest friends, the $3 billion for cancelling the Green Energy Project, and the $400 million to pay polluters.
It's a lot of PET scanners.
That's a lot of PET scanners, and that's a money tree that you guys love to just pull the leaves off and give to your best friends.
Yeah.
We have an overdose crisis in Ontario. There's no denying it. Everywhere you go, it is the #1 issue right now in Sudbury when I talk to people. They're upset, they're frustrated, they care about the community, they care about the people being affected, they care about their children who are put in harm's risk, they care about the number of people who are being killed, and there's zero information on the 21 consumption and treatment sites the government promised to put in place. And while we wait for the government to provide us details about how they're going to address the crisis, young people are dying. On a regular basis, they're dying. And like hallway medicine, there's going to be none of us who are going to be untouched by this. The Minister of Health and Long-Term Care has called it a public health emergency in the legislature. She used those words. But we've done nothing as a government to take action on this. We need to allocate resources to harm reduction services. We need to create public education programs, and we need to listen to people that need those services the most. But in the budget, none of the money is going towards this.
No.
Now, the member opposite talked about the dental program for seniors. And that is a good thing. Now, one of the things that stands out to me is that as a single senior, you have to be earning $19,300 or less. The poverty line in Canada is $19,930. I don't know where the math is, but $630 is a lot of money for somebody in the poverty line. On the one hand, I think as the government, we should be embarrassed that we have seniors living in poverty, that we think it's okay that there's people out there making less than $19,000, $19,300. But aside from that, I think it's a great initiative. It's a great way of taking care of people and caring for people. The problem is, in order to get the service, you have to go to a public health unit. Now, public health units are already super busy. But what we're doing is we're cutting it by, the province announced that we cut $200 million from the $1 billion public health sector, which is about a 10% cut. We're going to reduce the number of public health units from 35 to 10. I'm not sure where there's going to be located. I do know there's one in Sudbury. When you go to 10, today there is. I'm assuming that one is going to be in the north because the government seems to forget the north is vast. It's an 11-hour drive from Thunder Bay to Sudbury. So I hope it's not in Thunder Bay because it's a long drive for somebody who's making $19,000. So how will these public health units service their areas? With that sort of range and their scope being cut from 35 to 10, how will people reach out to it? And how will these low-income seniors access the dental program? How will they physically travel those distances or pay for the travel? Or what kind of wait times are they looking forward to as we cut them back? And I want to remind, and the member opposite said this, there are over 600,000 low-income seniors in Ontario. There's going to be 10 places for them to get these services. In education, now, I know that the member opposite disagrees about the cuts to education. I know that the involuntary job loss has no longer become a job loss. But no one will lose their job was a promise I had. I have to tell you, in my whole life, my oldest now is 22, so you spend a lot of time with other parents. I have lots of discussions with parents and Christmas greetings and stuff. Christmas concerts. I never heard a parent once tell me, I love everything about my classroom except it's not crowded enough and my child has too much time with the teacher. Yeah. I wish they were more crowded and the teacher had less time. Yeah. But instead what we're doing is we're saying, well, how bad could it be if we crowd them? What's the worst that can happen? Well, they'll have some resilience.
Thank you,
resiliency. And every time I hear the minister say, this will prepare them for the life of the future, in my head I say, this will prepare them for a government that doesn't care about them.
Very good.
You know, I'm running out of time, Speaker, so I won't be able to get to the rest. I'll speak to it later in debate. But I want to thank you for your time to speak about this. I think that Ontario deserves more than alcohol, gambling, and pet projects for vanity plates. Thank you.
Job.